Good evening, everyone. My name is Amy Brundle. I'm the Director of Marketing and Communications here at NAMI North Carolina, and it is a true pleasure to welcome everyone here for tonight's town hall. We're excited to host this event tonight in collaboration with the North Carolina Department of Health and Human Services, the Office of the Governor, the Wake County Sheriff's Office, and the Raleigh Police Department. Tonight, you'll hear from representatives from these agencies discussing the collaboration between justice, law enforcement, and mental health that is vital for the health of our communities as a whole. Tonight, during our town hall, if you have any questions for our speakers today, please feel free to put them in the Q&A section or the chat, and we will address them towards the end of our session tonight. Now, to get things started, I have the pleasure of introducing NAMI North Carolina's board president, Gail Pruitt. Gail has been involved in the work of NAMI for many years, having served as a former staff member, a former NAMI Walks North Carolina chair, and a former member of the NAMI North Carolina Public Policy Committee. Gail represents NAMI North Carolina in the North Carolina State Mental Health Coalition. She's also a retired psychiatric nurse with decades of experience working with the mentally ill and their families. Gail, welcome to the call. We appreciate you joining us today.
Thank you, Amy. And I noticed the stress and decades of experience, which is true. So I bring a warm welcome to everybody from NAMI, North Carolina. It's such a wonderful group to be in front of. I'm so glad everybody's here. You know, and many of you know this already. For NAMI, it has a deep, deep place in my heart. We bring such a wealth of services to people who don't have a clue sometimes about what's going on with mental illnesses, either as a person with lived experience or family members, colleagues. So we provide the support groups, the classes, the warm helpline, many different services to help folks along in their journey. There's so many dedicated staff and dedicated affiliate members that make up NAMI. Too numerous to mention by name, but we all work together shoulder to shoulder, and actually starting at the national level, working in the state and with the local affiliates to provide those services that are so needed. And I see it as a blanket of compassion, of caring, of understanding, that offers warmth and support for those with mental health needs. Many of you know we advocate for people with mental health conditions. We teach about mental illnesses. We provide support. We increase awareness about the potentials for people with lived experience and how they can live fulfilling lives. So many, many things are going on. But for us, I see the glass as half full right now, half full because of all the good work that's been going on so far, the partnerships that are taking place across the state already. An increase in CIT trainings, public safety officers and mental health clinicians going out on calls together in Durham or Burlington. The increase in mental health substance abuse courts that are springing up across the state. Forsyth, Brunswick counties, Guilford, Mecklenburg, New Hanover, Orange, Pitt. And there's also productive work going on with involuntary commitments and the related transportation needs related to that. And of course, there's good work being done by Governor Stein's executive orders. But the glass is also half empty because there's so much more for all of us to do. And that's why I'm so excited tonight about having this dialogue and coming together. Currently, there are pockets of collaborative relationships between mental health and law enforcement and justice across the state. Pockets of reduced stigma, pockets of treating peers with mental illnesses as people with potential for growth and productive lives. Last November at our NAMI North Carolina annual conference, the theme was 100 Counties, One Voice. So our job tonight is to continue with the work that's already been started, but to ensure that there's no more pockets. Instead, there is a blanket of mutual respect and support across the state for everyone involved in the lives of people with brain disorders. So I'm excited about the rest of this evening, and I'm already looking forward to part 2 in April. So thank you for this opportunity to come before you. And I believe I turn it over now to Amber. Or Amy, are you going to introduce Amber?
Definitely can. We are happy to have Amber Harris, who is the Deputy Legislative Director of the Office of the Governor. She is going to share a few remarks from herself and Governor Stein. Amber Harris currently serves as the Deputy Legislative Director, but prior to this role, she served as Director of Policy and Advocacy at the North Carolina Association of County Commissioners. She is a North Carolina native, currently residing in Durham, and that's where she's joining us from tonight. Amber, I'll hand it over to you. Thank you so much for joining us.
Absolutely. Thank you for having me. And I want to start by dittoing everything that Ms. Gale said. That vision you laid out for support for folk with mental illness in our state is really extraordinary. So my name is Amber Harris. I am Deputy Legislative Director, as Amy said, in the Office of Governor Stein, and I'm bringing you greetings on behalf of the governor this evening. He wasn't able to join the town hall. I also want to say on my slide, it says I'm a North Carolina native, and I am, but I'm also a Durham native. And if you know people from Durham, you know that we have to rep our city wherever we go. So shout out to the Durham folk in the building. We're so grateful to partner with NAMI on this work. There is a lot going on in both the criminal justice space and behavioral health space, and looking forward to hearing what the governor is going to say here in a recorded video in a few minutes, and also from Kelly Crosby. So with that, I'll turn it over to Lillian to play the video. Thank y'all for having me.
Good evening. I'm Josh Stein, and I'm honored to serve as your governor. I regret that I can't be with you in person, but I'm pleased to join you by video for the Justice in North Carolina Town Hall. Thank you to Lillian Davis and the National Alliance on Mental Illness for your leadership and for your long-standing partnership with the North Carolina Department of Health and Human Services to meet the mental health needs of folks in every corner of our state. I'm also grateful that Raleigh Deputy Chief of Police Eddie Buffalo, Wake County Sheriff Willie Rowe, and Wake County Sergeant Philip Sutton are joining today's event. And also that my colleague, Kelly Crosby from DHHS, is here to share from a healthcare perspective. Your work on the front lines of public safety and behavioral health makes a real difference. So I want to thank you for your commitment to keeping people healthy and keeping them safe. In recent months, we've seen too many tragic incidents in North Carolina involving people experiencing severe mental health crises. Some folks experiencing paranoid delusions may pose a public safety risk, and whether or not that's the case, all of them deserve access to care. After visiting behavioral health urgent care centers and crisis centers, speaking with people like you who work in public safety and behavioral health, my team and I have identified some gaps where we can do better for North Carolinians. Last month, I signed an executive order to strengthen the connection between our behavioral health and criminal justice systems. The order improves coordination through each and every phase of the judicial process, from first contact with law enforcement to reentry after incarceration. It supports the professionals doing this difficult work and helps ensure that people in crisis get appropriate care while keeping our communities safe. Your expertise was essential to the drafting of that executive order, and your partnership will be just as crucial for its success. This behavioral health executive order is an important step, but lasting progress requires a more holistic approach with a larger team effort. I continue to urge the General Assembly to pass a comprehensive state budget that fully funds North Carolina's essential needs. a budget that strengthens Medicaid, protects food assistance, expands access to safe and affordable housing, supports good jobs, and invests in our state's excellent public schools. Stable housing, healthcare, and economic opportunity are essential to improving mental health and public safety. We know that keeping people safe requires getting people help that they need before bad things happen. I'm encouraged by the collaboration represented here today, and I'm grateful for the work that you all do every day in your communities. Now let's keep working together to build a North Carolina that is safer, stronger, and healthier. Thank you, and enjoy today's event.
Well, we really appreciate the Office of the Governor, Stein, sharing that with us. Thank you so much for those remarks. Really appreciate that. We'd like to also welcome Lisa Lowe Hall as our interim executive director from NAMI North Carolina to share a few remarks on the mission and vision of NAMI.
Well, the mission of NAMI North Carolina is what we always said it is. It provides mental health advocacy, education, support, and public awareness so that all individuals and families can build better lives. I'm sure Lisa would tell you that the vision for NAMI North Carolina is where we envision a community where all people affected by mental health conditions can live healthy and fulfilling lives. If she is able to get on the Zoom later, we will let her come forth and say a few remarks. Amy, we'll move forward to our next presenter.
Well, I am excited to introduce Lillian. Is that? Yes. Lillian, would you like to share with us the purpose of our town hall today?
Thank you, Amy. And I thank you, Amy, more importantly, for your work. You're always willing to work with me as the Director of Marketing Communications. So thank you always for your support and participation. So tonight, again, I am Lillian M. Davis, the Director of Public Policy and Advocacy. And over the past year, we have tried to increase our partnerships with community partners, as well as our view on advocacy and how we all in different municipalities play a role in public safety, mental health initiatives, and being able to take mental health to the next plateau. So our Justice in North Carolina Town Hall tonight is how we partner at NAMI North Carolina with our state government and law enforcement officials to make sure that we are being able to share their successes, their current priorities around justice, law enforcement, and the increase of mental health. We have always been a partner for CIT, and so it is our honor tonight for us to come together and to express to the world how we have joined forces to continue to enhance and to meet the disparities in this community. So thank you to all of the panelists and all of the participants tonight that were willing to come forward first for this partnership and to ensure that we had a justice in North Carolina Town Hall to make sure that our constituents are aware of what we are doing together.
Mm-hmm. Yes, thank you, Lillian, and thank you for the incredible work that you've done to put this together. It wouldn't have happened without your tireless efforts. At this point, I'm excited to introduce one of NAMI North Carolina's most treasured collaborators, Director Kelly Crosby. Kelly brings over 30 years of experience in providing and managing public services and supports for people with mental health and substance use issues, intellectual and developmental disabilities, and brain injury. In her current role as the Director of the North Carolina Department of Health and Human Services Division of Mental Health, Developmental Disabilities, and Substance Use Services, Kelly oversees the public community-based system for mental health, intellectual and other developmental disabilities, substance use, and traumatic brain injury in North Carolina. For years, Kelly has served in multiple leadership roles within NCDHHS, including Assistant Director of Behavioral Health at NC Medicaid, Chief Operating Officer of NC Medicaid, and the Chief Quality and Population Health Officer at NC Medicaid. Kelly is proud to be a licensed clinical social worker and person with lived experience, and one of our favorite people to have on. Kelly, please take it away.
Amy, Lillian, Gail, thank you so much for having me tonight. And it's always hard to follow Deputy Director Harris and the governor. So I am super, super proud to be here tonight. It's no secret, I'm a huge fan of NAMI, huge fan of NAMI. I appreciate the work that NAMI does every day for families and people with mental health needs across the state. But also they're in all the important spaces we need them to be in terms of lifting up the right policy. And so I want to thank you for your leadership in having this town hall tonight, convening us all together for this really important conversation. So thank you so much. And thank you for your partnership. So what I want to talk about tonight, there's always so many things happening in our system, but I really wanted to spend a moment today talking about the executive order that the governor referenced, that he signed into law 2 weeks ago. I just want to spend a few minutes walking through it, the rationale for it, and some of the directives that the governor has given to us, his cabinet, to really focus on in partnership with the community. So if we could go to my next slide. This is us. This is the wonderful day of the signing of the executive order. It was an incredible celebration. Obviously, our friends at NAMI were there. I want to walk you through the executive order. On the next slide, I want to talk a little bit about the rationale. We talked about this at the executive order. And these are things, again, this is a community of folks who care and understand the issues. So I probably don't need to spend a great deal of time on the rationale. But we know that about 50% of people in jail and prison identify as having mental health issues. And that rate is even higher if the individuals with substance use issues. About 75% of individuals who are in our jails and prisons are identifying as having a substance use disorder or substance use need. That's even more alarming for juveniles who are involved in the juvenile justice system. Almost every juvenile who's involved in the juvenile justice system actually has a mental health diagnosis. So we know that in order to meet the need and in order to support people in the justice system or who are at risk of being involved in the justice system, we need to address this really important issue. Another really important statistic that I don't think we think about all the time is that more than 90% of people who are incarcerated go home to the community, go home to their families. And so we need to make sure that we're supporting them, especially, again, all of them, but especially those with mental health and substance use needs as they're returning back to the community. The transition is often incredibly hard. We want to make sure that they are successful, and that means getting them the right mental health and substance use supports. And as the governor said, you know, I'm the state mental health director, right? I'm going to talk all about mental health, substance use, and making sure that we're supporting people. That's a priority for us. It's a priority for a healthy North Carolina. But the governor also talks about public safety. It's actually really important as well, obviously, right? And so making sure that we have a healthier North Carolina, that we're focused on mental wellness and recovery is actually good public policy for public safety, and we know that. Next slide, please. So where our system needs support, there's a lot of places. So we know I'm just honored to be here with the different sheriffs and law enforcement officers here on the call today. It's always a pleasure to spend time with them in the community or be on panels with them. But we've heard from them again and again that they're often overburdened, and it can be a challenge for them to meet the demands that they're called into when people are in mental health crisis. They need additional supports. They need our mental health system to step up and support those individuals. We need to support them better as good partners rather than putting all the burden on them to be the default responder when someone has a mental health crisis. We know that we just don't have enough workforce. In our state hospitals, we know we have a huge workforce crisis. We do not have enough psychiatric beds open in our state facilities. We know that law enforcement offices themselves have a workforce crisis. Our Department of Adult Corrections has a workforce crisis. So those really critical places where we need dedicated workforce, we're really struggling to recruit and also retain that workforce. Improving all of the things that I mentioned, whether it's having enough workforce, whether it's having enough supports in a facility or in the community, requires incredibly important and deep collaboration, which is why the governor signed Executive Order 33. He mentioned in his address that this is not a budget, this is not new money, but I can tell you as one of his employees, it is a very powerful thing when your governor says, hey, my cabinet, my Department of Health and Human Services, my Department of Adult Corrections, my Department of Public Safety, my Office of State Human Resources, I need you to work together collaboratively on a unified vision to support both public safety and the mental health and substance use needs of North Carolinians. And so that's what he's done. And so I'm going to walk you through that right now. So on the next slide, I'm going to start talking about Executive Order 33. So what is it? It establishes a statewide cross-agency framework. I already mentioned Department of Health and Human Services, Department of Public Safety, Department of Adult Corrections, Division of Juvenile Justice, Office of State Human Resources. It starts with the notion that we need a strong crisis system in North Carolina. If we have a strong crisis system, we should be able to get people diverted into the mental health system instead of into the criminal justice system. He asked us to coordinate better as a department and focus on the joint priorities of behavioral health and public safety for North Carolinians. Next slide, please. So these are some of the things that the executive order directs us to do. I want to walk you through them because you know me by now, everybody on this call, you know me. This means this is what my team is working on very clearly. And this means this is what I'm going to ask you to help with. I'm going to ask you to help us, right? So that's why I really want to go through this and make sure you know everything that it says. So the executive order directs the department to lead statewide coordination to strengthen the behavioral health crisis system. We need better consistency across the state. We need consistent access, and we need it to actually be effective. We also need to make sure that it is financially sustainable. We've been building in North Carolina for some time, someone to call, someone to respond, in a safe place for help. 988 should work really well. We should have enough crisis responders who are there in a timely fashion. We should be able to transport people without using law enforcement. And we should have community crisis facilities that people can go to. We don't have that kind of consistent network across the state. We've been working on building it, but it's very fragile. It's very fragile. And the infrastructure we do have, not everyone knows about. So he's directing us to make sure that we have a unified, consistent mental health crisis system across the state, and that we have a plan for its financial sustainability. On the next slide, he takes it a step further. Part of the issue about the fragility of our crisis system is that not everyone pays into it. The public crisis system is funded only by Medicaid and state appropriations. So I have private insurance, I have state health plan insurance. If I or my son would go to a crisis facility, it would not be covered. I would either have to pay out of pocket, or the LME would have to use some state dollars to cover my time at the crisis facility. So the governor is directing us to convene all payers across North Carolina to make sure that all payers are paying for this crisis level of care, whether it's a mobile crisis team, whether it's a behavioral health urgent care, whether it's a facility-based crisis. We all need to pay into that system. That is part of its sustainability. Next slide. The governor directs us to make sure that we have a coordinated 911 and 988 system. I hope everybody on this call knows 988 at this point. I hope so. Don't know that everybody does. Usually, I'm among friends, right? So usually our NAMI friends know all about 988. And 988 awareness and knowledge is growing, but still there's a lot of folks that do not know that you can call 988. They do not know that 988 can talk them through a crisis, that they can deploy a mobile crisis team to their home. They can stay with them on the call until mobile crisis gets there. They can direct them to the nearest crisis facility. But a lot of people do know. Over 12,000 people call. About 10% of those calls are crisis calls. Very few of those calls, very few, less than 1%, are diverted to 911 or directed to law enforcement. So it's very, very few of those. Most of those are handled within the mental health crisis system. 988 has protocols for handing things off to 911. We need the same. We need 911 to have a very close working relationship with 988 so they can share data, they can triage calls together. We can get more mental health professionals actually embedded in 911 call centers so we can triage calls to have mental health professionals respond or mental health teams respond. So this is a big one for us, having a 911 and 988 system that coordinates together and triages. So we're pretty excited about this one, but it's a lot of work, so we'll need your help. Next slide. The executive order also calls on us to work with local law enforcement to stand up more co-response teams. We at the department right now, we fund about 8 co-response teams. So that's eight counties or cities. There are other really robust co-response models across the state. I've had the privilege of meeting with those different teams and seeing the good work that happens in counties. So co-response, I think you'll know what that means. It means if law enforcement EMTs go out to respond to a 911 call, they can take a mental health professional with them for support. There's a growing interest in those. They can be hard to fund. We would love to be able to support as many law enforcement teams as possible to have a mental health professional on their teams. So the governor has called on us to work with local law enforcement to, in cases where we can fund, but also to support more of these co-response teams. Next slide. The governor wants us to keep working on non-law enforcement transportation. For a very long time, North Carolina has defaulted to 2 things. We've defaulted to involuntary commitment for anyone, even those who could easily go to the hospital on a voluntary basis. And 2, we've defaulted to every county's plan, almost every county's plan for crisis transportation is law enforcement. We know that there are better ways. Across the state, there are hospital systems that have their own transportation system among their own hospitals, not to other places. But at this point, still too many hospitals rely on involuntary commitment and law enforcement for transportation, but also for monitoring people who are in holds in emergency departments. First, I want to thank law enforcement for that. I need to say that, okay? Second, I need our system to do our part. Third, I need to make sure that we're not inadvertently criminalizing having a mental health issue, because that's exactly what we're doing, right? People with depression, anxiety, people with thoughts of self-harm can commit themselves to a hospital without involuntary commitment, and they can certainly travel in an ambulance or with a family member. But we've got a lot to change to make that work in North Carolina. So we've been working on this, and we need to continue to work on it. The governor says, do better, do harder. We need to make sure our law enforcement folks are targeted where they need to be, and that the mental health system is helping manage crises and using mental health professionals for holds and for transportation. Next slide. The governor has directed us to convene a statewide working group on involuntary commitment. Now, many of you know that the North Carolina House has an involuntary commitment subcommittee. We've all been attending. I see Lillian there every month. She and I go together. Sometimes we present. But we've heard from everyone about Arena's law and how that changes IVC in North Carolina in the ways that IVC isn't working already in North Carolina. We've heard wonderful, good recommendations for how we can improve the IVC process. We have some good ideas for how we can improve the IVC process. And again, the goal really is to make sure that those who do not need involuntary commitment don't do it. They can work with a mobile crisis team. They can go to an urgent care. They can go to a facility-based crisis. A family member can take them. A mobile crisis team can take them. they can get help and healing at a local community crisis center. Only in cases where we absolutely need it, where an individual is at risk of hurting themselves or others. We know that happens. We have to be honest about that, right? We care about those people. We need to make sure they get care and safety, and sometimes they do not have the wherewithal to realize that themselves. It happens. In those cases, we need the IBC process to work, but we still need our crisis response teams in those moments as well. We need to make sure that magistrates and law enforcement have mental health clinicians that can give them good assessments, good triage, and good support during the IBC process. So that's what we need. We need to do a lot of things. So we'll be convening a group to work through recommendations and changes to make the IBC process work better for all involved. Next slide, please. This is a biggie, y'all. This is a really big one. So I've mentioned a lot about crisis. I've mentioned making sure it works, that 988 and 911 works, that IBC works way differently than it does today. But for people who are re-entering the community, we need to make sure that we have really strong re-entry services. We don't lose people. People get lost all of the time. There's never enough workforce to make sure that people re-entering the community are able to get engaged in mental health treatment, substance use treatment, are able to get connected to work, are able to have a transitional place to live. We really struggle. We don't have enough resources for it. And that is how people are lost to contact. That is how people are lost to care. And people unfortunately end up back in the cycle of re-entry into the justice system rather than into the community. So the governor calls upon us to focus on both adults and children, to work specifically with the Department of Adult Corrections, fellow cabinet agency, Department of Public Safety, who oversees juvenile justice work, okay? They oversee the Juvenile Justice Department. For us to work collaboratively on kind of two big things. One, the care that people receive while they are incarcerated. What treatment do they get while they're incarcerated? And how are they transitioned successfully? How do they maintain treatment as they move back into the community? So we're called to work collaboratively on that continuum of care. We have already launched some good evidence-based models in North Carolina. We have things like TASK, we have things like FACT, but we need more of it. We need it to be consistent, and we need to make sure that we're providing wraparound supports to people who are re-entering the community, whether it's an adolescent or an adult leaving Department of Adult Corrections. Next slide. And I'm about winding down. This one's really critical. So I'm the state mental health and substance use director, but we also have a state operated healthcare facilities division at DHHS. Those are the folks that run our state psychiatric hospitals, regular units and forensic units. You all know that we have many beds that are open right now. We have over 300 beds that are open because we do not have staff. And we know the backlog that creates in community hospitals and emergency rooms, in jails. We know the backlog that creates. So the governor has directed us to work with the Office of State Human Resources to work on recruitment, retention, and adequate funding for our psychiatric facilities, so we are able to open more state facility beds. That's really critical, really, really critical. People need sometimes to be hospitalized. They just do. And our state facilities are for individuals who often have very severe illnesses, who might need a bit of a longer hospitalization they could find in a community hospital. And our state operated healthcare facilities are also often uniquely poised to help individuals who have justice involvement. So it's really critical that we get more beds open in our state facilities. All right, next slide. So this is where I'm going to do the wrap up. So what does all that mean? I'm going to repeat myself, and I'm going to repeat some of the things the governor said. He wants us to focus hard on behavioral health and public safety. He wants us to make sure that we have a high functioning mental health crisis system. It's got to work. It's got to be timely. It's got to be effective. People need to know about it, and it needs to be financially sustainable. He wants to make sure that we have a good collaborative relationship and handoffs between the mental health system, emergency response, so everything from 988 to 911 to mobile crisis teams to law enforcement response teams to EMTs, our public safety system. These teams have to work together, whether it's a co-response, whether it's a 911 to 988 handoff. And I've heard a lot about this. Our law enforcement partners, our public safety partners need to know that the mental health system will show up in a timely fashion, will de-escalate, will support, and will help to get someone into treatment. We need to make sure that we have an improved transportation process and process in emergency departments that works for everyone, and doesn't be, is therapeutic, is what we call trauma-informed, right? Which is informed by mental health treatment, which isn't using law enforcement in places where we're better served by people with mental health. So we let our law enforcement partners doing the things that they need to do to keep our community safe. And overall, we need to work on the whole continuum of care. I've talked about crisis a lot. Crisis is about diverting people from the justice system in the first place. He wants us to work on care while people are incarcerated. Needs to work really well, whether they're in adult corrections, whether they're in our state-operated healthcare facilities, whether they're in a capacity restoration. I'm looking at Sheriff Rao right now. He's got a capacity restoration program right here in Wake. We need to make sure that's fully funded, well-functioning. He's getting the supports he needs for his program here in Wake. And then we need to make sure that we're doing our part in the community to partner with law enforcement and support high-quality reentry. The whole press release is there. The whole executive order is there if you want to read it. It's a lot to do, but it's the right thing to do. So again, I want to end by, again, thanking Gail, thanking Lillian for hosting this, thanking the governor for his support, and thank you, an extra special thank you to my law enforcement partners. I always say that our deputy of public safety is my new best friend, because we're going to be best friends for the next 4 years working on this stuff together, and that's okay. That's a good best friend to have. This is just a link. If you ever want to know about what's happening in the mental health system, you can sign up for our website. Okay, Lillian, I think I'm going back over to you.
Director Crosby, I thank you for your dedication, most importantly, your transparency and your compassion about mental health. Director Crosby, you have done some amazing things and made sure that mental health initiatives are at the top of any discussion. But most importantly, NAMI North Carolina thanks you tonight for the innovative ways in which you have just did your part in ensuring that regardless of what people say, that there is a way to meet someone's needs in this community. And we thank you, Director Crosby, and we're excited and to continue our partnership with you. Thank you again for supporting us tonight. We will now transition to our Justice in North Carolina panel. We have a great and amazing panel. It was just amazing to go through and read their bios and see all of the actual achievements of what they have done professionally, but most importantly in the organizations in which they serve. So I want to say that word tonight, that they are servants for this community and to ensure that we have civic engagement, public safety, and that mental health and the needs of this community are met. So it is my honor to go and to introduce our first panelist tonight, the Deputy Chief, Eddie M. Buffalo Jr., representing the City of Raleigh Police Department. He is the retired Secretary of the North Carolina Department of Public Safety. He has joined the City of Raleigh Police Department as the Deputy Chief for the Administrative Service Division. Deputy Chief Buffalo brings more than 3 decades of diverse and respected law enforcement experience. Most importantly, he has served as the Secretary of the North Carolina Department of Public Safety, where he oversaw more than 21,000 sworn and civilian employees, along with 13,000 soldiers and airmen of the North Carolina National Guard. His leadership spanned in juvenile justice and delinquency prevention, alcohol law enforcement, and the Office of Violent Prevention, Homeland Security, and Emergency Management, including the statewide response to Hurricane Helene in 2024. Throughout his career, Deputy Chief Buffalo has served in multiple senior leadership roles. He previously held dual responsibilities as interim city manager and director of the Elizabeth City Department of Public Safety, and he has served as a police chief, sheriff's office leader, and correctional officer with the North Carolina Department of Corrections. In addition, he proudly served 10 years in the North Carolina National Guard and is a past president of the North Carolina Association of Chiefs of Police. Deputy Chief Eddie M. Buffalo Jr., we welcome you tonight to our panel. Our next panelist is no stranger. He is Sheriff Willie Rowe for the Wake County Sheriff's Office. Sheriff Willie Rowe is a 31-year veteran of the Wake County Sheriff's Office. He started his tenure as a deputy in 1985 after serving our country in the United States Army as a sergeant. He may have retired from the Sheriff's Office in 2013 as a major, but he did not stop serving Wake County. Sheriff Rowe continues to serve in other leadership capacities in the state and county. He serves on the North Carolina Emergency Response Commission, the North Carolina Sheriff's Association Legislative, Advisory, and Audit Committees, and as a board member of the Wake County ABC Board, the Raleigh Interchurch Housing Corporation, and the Fellowship Home Foundation Board. During his time at the Sheriff's Office, he has contributed to various divisions, starting as a deputy sheriff in the Patrol Division, and then becoming an investigator for the Criminal Investigative Division in 1987. In 1988, he took his investigative skills to the Drug and Vice Unit, where he served until 2003, moving up the ranks from investigator to captain. Sheriff Willie Rowe was also a captain in patrol in the Special Operations Unit. He was promoted to major in 2007, first in the Criminal Investigation Division, then Patrol Division, and retired as a major over the Special Operations Division in 2013. As a Raleigh-born North Carolina native, Sheriff Willie L. Rowe is committed to making Wake County the safest place to live, work, play, visit, and learn. Welcome, Sheriff Willie Rowe, to our panel discussion tonight. And our last but not least panelist is Sergeant Philip Sutton from the Wake County Sheriff's Office. Sergeant Philip Sutton has worked for the Wake County Sheriff's Office for 15 years and in law enforcement for 17 years. He holds a BS degree from Welch College and a Master of Science in Criminal Justice Administration from the University of the Cumberlands. He has recently been assigned as project coordinator within the Sheriff's Office for the Bridging the Gap Community Mental Health Grant, working with NAMI, North Carolina. Prior to this assignment, Sergeant Sutton spent several years working in the Sheriff's Office Crime Prevention and Community Engagement Unit. He also is a North Carolina General Instructor, Crisis Intervention Team, CIT certified, and enjoys teaching in the Sheriff's Office academies. Again, Sergeant Philip Sutton, we welcome you to our panel discussion tonight. So we have given you a list of questions tonight prior to this event. So we're just going to go through a few of our questions as a panel and let the constituents in the community just learn a little bit more about you and your organizations. So at this time, I want to make sure that we have Deputy Chief Buffalo. Are you on?
Yes, ma'am.
Hi, good evening.
Good evening.
Deputy Chief Buffalo, please introduce yourself and tell us about your new role at the Raleigh Police Department.
Thank you. Good evening, everyone. As been previously introduced, my name is Eddie Buffalo. I serve as the new Deputy Chief for the Raleigh Police Department. I oversee the Administrative Services Division, which encompasses the Chief's Office, our Professional Standards Division, as well as our Administrative Services Division, which encompasses HR, budget, evidence, what have you. And I'm delighted and grateful for the opportunity to be here with you and to participate in this town hall along with my fellow law enforcement colleagues. So looking forward to the conversation.
Thank you, Deputy Chief. Sheriff Rowe, tell me a little bit more about yourself and the Wake County Sheriff's Office.
Well, good evening, everyone. Thank you for this opportunity and thank you for the privilege of your time. I am Willie Rowe, and I'm so honored to be your sheriff. I thank God each day for the privilege to serve. As agency head, I'm responsible for identifying and communicating the vision and mission of this agency to facilitate obtaining and managing the resources and the daily operations to achieve our mission, which is to keep you safe so you can live life to the fullest.
Thank you, Sheriff Rowe. And then Sergeant Sutton, tell us a little bit more about your new role and partnership with NAMI, North Carolina.
But good evening, everybody. I am excited for this new role. As stated in my intro, the last several years I've been working with crime prevention and community engagement and really trying to be the face of law enforcement and strengthen the partnership that we should have with our communities that we serve. And in this new role, as the Bridging the Gap coordinator, one of the things that Ms. Gail has alluded to, the many different programs NAMI has. And so we're partnering with you all to take these programs into the community, because so many people out there in our county do not know the programs that are afforded to them, that are available to them. And that's what we want to do, as well as to our staff, to make sure that they are healthy enough to go out and serve the community and be there when we're called upon.
Thank you, Sergeant Sutton. Now, why we have this town hall tonight is that we really want to address partnership, but most importantly, we want to address and let you be able to share with the community and the constituents tonight, what have you done to increase public safety and community engagement? Deputy Chief Buffalo, what can you say for the Raleigh Police Department?
Thank you, ma'am. That's a great question. It speaks directly to one of our core strategic priorities that Chief Boyce has set. Public safety is not achieved through enforcement alone. We can't arrest our way out of this situation. We must strengthen our partnerships. We must strengthen our collaboration. We must have a multidisciplinary approach. You know, over the past, I'll say, few years, Raleigh has been very deliberate about the commitment in deepening their engagement with the community. And those initiatives like Raleigh Hoops Night, Cops on a Block, summer camp, youth camps, and our Community Police Academy. These programs particularly and intentionally create opportunities for our officers and our residents to interact with each other outside of a crisis. Not only that, it allows us to listen and to be transparent and to build trust with one another. And when trust exists, that communication improves. The communication not only improves, but it's cooperation to follow up. And it's a duty for us to interact with our citizens. And so working together, as Sheriff Rowe alluded to make the entire city, this entire region, this entire county safe. So community engagement is not just a public relations thing, but it's a proven safety strategy.
Thank you, Deputy Chief Buffalo. That's amazing. Now, Sheriff Rowe, what can you share with us tonight about the Wake County Sheriff's Office?
We've been intentional and deliberate in our focus to develop community partnerships in order to increase our interaction with the community, also to build trust. And one focus has been on our relationship with business partners. Business partners such as Chick-fil-A, Walmart, Target have provided funding to allow us to provide service to programs such as our Well Check program for our seniors who live alone. They get a daily call from this office to check on their welfare, to have different events, outings for our seniors, such as a summer picnic, a fall festival, a Christmas dinner. We give them birthday gifts, Valentine cards, Easter cards, and baskets. We also been able to focus on our coffee with the sheriff, ice cream with the sheriff, and our senior assisted living facilities, bingo night with the community, with our youth. We've expanded our DARE program in our middle schools and elementary schools. We've been able to hold kickball tournaments, pickleball tournaments. Again, the partnership with the Special Olympics, that we've raised money to support those athletes. We've also partnered with the Boys and Girls Club, the Salvation Army, Raleigh Parks and Recreation. We've just, anybody that wants to make life better for people, we've been able to hold town halls with the community, listening sections, gather that input so we know how to be a better neighbor, good partner. We've also had our toy drives, our back to school supplies. We did shop with the sheriff during the Christmas. We even went to one school and we did a pizza party for a class who were not able to participate in shop with the sheriff because of some challenges they faced. So we thought we would bring the party to them. We provided pizza. We brought in our peer support canines, our poodles. We gave the gift card. The teachers were able to purchase gift from online, have it delivered to their houses. So we're just trying to think outside the box, how we can be a good neighbor, a good partner, and let people know that we care and they matter.
Now, Deputy Chief Buffalo and Sheriff Rowe, NAMI, North Carolina has had the opportunity to participate in your Shop with the Sheriff and Shop with a Police Officer, and it was just amazing to see that type of civic engagement with our local children and how they're able to now get a more secure and have a comfortable relationship now with law enforcement. So I was able to see that this year, and it was just amazing to see those kids interact with each of your offices. Now, let's go back. I've seen each of your strategic plans and your areas of focus, and I'm amazed at your transparency and where you're able to actually show a blueprint of what you're going to do in the next years. But I want to highlight tonight what things that are new that you have never done before that you implemented this year. Now, I read a few things that I know I've never seen. So Deputy Chief Buffalo, tell us a few things that are new and out of the box, like Sheriff Rowe just said, that you have never done before at the Raleigh Police Department that you would like for everyone to hear about tonight.
Sure. And starting in 2026, we are continuing our modernization and innovation. One of the most significant things that we're working on is the launch of our Crime View dashboard. This will be a new digital tool, will allow anyone in our community to independently access and review crime statistics and incident data at their fingertips that's happening in our city. This goal is very simple to us. It's transparent and it builds trust. We're in the final stages of developing that particular portal and website and anticipate it coming online probably the end of the first quarter of this year. In addition to technology, we continue to build a strong community momentum that we established in 2025. And so we're in our second year of Hoops Night. We're going to expand Cops on the Block, our second installment of Community Police Academy. But one of the things that we're going to do differently is officer wellness. We feel like there was an adage I learned a long time ago: hurt people want people to hurt. But what we believe is healthy people will help people. And so we want our officers to be healthy because we feel like if they're healthy, then they will help people. And so that's something that Chief Boyd's number one priority is our officer wellness as well as our Crime View dashboard.
Oh, Lillian, let's have you repeat that. We're having some trouble with your audio.
Can you hear me, Amy?
We got it. Thank you.
Okay. All right. So again, Deputy Chief Buffalo, we're going to use that statement. Healthy people will help people. Okay. So don't you get NAMI, North Carolina, if we use this in some of our upcoming campaigns. Okay.
No problem.
All right, Sheriff Rowe, tell us about the Wake County Sheriff's Office. What is new and approved or something you've never done?
I think the fact that we understand also that wellness is very important for the staff members as well as their family. So we have a peer support coordinator. We have a peer support team. They meet monthly. We also have a chaplain with the team. We brought on 4 peer support therapy canines, 3 poodles and a lab. We have our peer cheer and care cart that we push around the office that has coffee, tea, snacks, squeezable items to allow staff a moment to just decompress from all the things they face and they challenge during the day as they serve and protect. We have really focused on bringing the family involved as well, because there's no such a thing as separating work and home. It follows your home. And when spouses and children see their loved one encountering the dangers they do because of social media and television, we have to be able to address that. So we have programs where we bring them in. We work with Healing Horses and other organizations, nonprofits that we found out really works at stability and letting people know that we care, that they matter, that they are valued. We've also introduced our Sheriff app to the public so that you can go on that app and find out any information you need here at the Sheriff Office regarding our services, who's in jail, full statistics, anything you need to know about the Sheriff Office. If you have a paper that needs to be served, we have all this listed. Also help for people and everything. Again, our initiatives have been newly is that as we focus on, reducing violent crime, drug distribution and addiction, bullying and scams, we are really focused on combining the efforts of public safety and public health to provide service to address mental health, total health, and the total well-being. We believe that this new approach, we want people to know and understand that public safety is public health is public safety. So when we combine these efforts of law enforcement, our medical providers, our nonprofits, and we're able to provide, it's key to a total wraparound services that people need, whether incarcerated or leaving our facility to return to community. We want them to have the support they need to be productive and not to reoffend. And because when they reoffend, we cause not only is it bad for the perpetrator, but it's bad for the community because they become victims of crime. And our goal is to keep you safe so you can live life to the fullest.
I love that, Sheriff Rowe, where you said wraparound services, public safety and public health, how they coincide equals a total well-being. I like that. Thank you for sharing that tonight. So, Sergeant Sutton, okay, you have a new position. Okay, it's not new in some of the components of what you have done previously, but how will you take your new role and what new will you do in that new role to help engage the community and to actually approach different mental health needs in the community?
Absolutely. So with the grant funds that we've got in partnership with you all, as you know, we stated Wake County is the most populous county in North Carolina right now, and you've got over 66 people moving in per day to Wake County. And with that many people moving in to our county, so many people don't know the resources that are offered to them and for them. And so part of what this partnership is bringing those out to the community, whether it's mental health first aid classes, whether it's self-care trainings, peer-to-peer support, family to family, the stigma-free workplace training, some of these things that many people don't know are out there and available to them. We want to work with you all and engage in the community and bringing that out to them. But also one thing that Ms. Crosby said, that over 50% of the jail population's got a mental illness. And so obviously we have a lot of people in our detention facilities, and that may be some of them that struggle with that. And so this grant partnership also is going to take that into our facility with the detention officers there, but also the inmates there, and then also their families, and not just while they're there, but upon their release, making sure that they leave our facilities with the tools they need to have a good mental wellness moving forward and to be successful and to cut down on recidivism and getting them back in. We want them to leave, to live a successful life and to move forward. Those are some of the things that we look forward to partner with you all and taking it to the community.
Thank you, Sergeant Sutton. Now we're going to move on and talk about what we know we have done for years in partnership with both of you, and that's our CIT. And so how will you take, let's say, how will you increase your recruitment and the use of CIT in the community, and how will you help NAMI North Carolina endorse this program more in the community? Deputy Chief Buffalo?
Yeah, thank you for that question. Specifically, our agency has a specialized outreach team. If you haven't heard of it, it's called ACORNS. It means Addressing Crisis Through Outreach, Referrals, and Network and Service. And so this team is dedicated to connecting individuals in crisis with services to support that need. It's real time. They're out every single day. In 2025 alone, this Acorns unit responded to a significant number of calls for services involving individuals experiencing mental health challenges. But they were so focused, and they have the connections with resources, and they also work on de-escalation as well as resource connection and long-term solutions, because this is just not a short-term response from this unit. This is long-term. We want to follow them through. And I got to give a shout out to the team. As we talked about the governor's EO, most recently, Governor Stein recognized the impact of their work, inviting members of the unit to stand with him as he signed this new executive order. And that recognition underscores the importance of the collaboration and partnerships in addressing our mental health challenges here in Wake County and the Raleigh area, as well as in our state. And so public safety today, so working with you all, not just in the traditional policing set anymore. We can't do things like we did it when I started 30 years ago. It requires a coordination with our healthcare providers, our social services, our community organizations, our public and private partnerships. And NAMI North Carolina is one of those that we partner with, and we want to make sure it's robust. And this unit, Acorns unit, we feel like it exemplifies a collaborative approach.
Deputy Chief Buffalo, we have also given them a CIT award. And then we did give them a press conference. So thank you. All right, Sheriff Lowe, I have in store.
Okay. What I like to emphasize is what I call a salute to the Fantastic Four of Wake. Wake Fantastic Four consisting of the Wake County Public School System, Wake Tech, Wake Med, and the Wake County Sheriff Office. As that collaboration there has allowed us to prepare ourselves and deploy ourselves in a way to make the community better. When I came into office 3 years ago, we were 300 staff members short. We've been able to hire 366 people since I've taken office. We've completed 7 basic training academies for law enforcement, 7 basic training academies for detention officers. And because of that collaboration, we've been able to do that. We've improved our medical services for our inmates. We have over 1,600 inmates in our facility, and where we have to provide medical services. I have 2 doctors, 3 PAs, 44 nurses. And when you factor in the mental health aspect, there's a lot of moving parts that they are responsible for to keep them healthy and maintain well-being. So we understand when it comes to CIT, we want every staff member CIT certified, because every profession, every community, every family is impacted by mental health. And so CIT training gives everybody the tools to be equipped to understand, to bring awareness, and how to respond when a person is experiencing a crisis. When I look back at our crisis in 2022, we had 144 calls. 2023, 134. 2024, 204. 2025, 178. Then when you factor in the other municipalities here in Wake County, that number is much higher. So we need to be trained and prepared. How do we bring these services, health and human services, law enforcement, and nonprofits together to safely address these situations, bring the resources, contain it so that no harm is done and everybody comes out successful. So we've been happy that as we work together and get everybody certified, it helps the officer as well as their family and the community that we serve.
Thank you, Sheriff Rowe. Now we're going to move on to one of our most important questions too for you, Sergeant Sutton. Okay, you have a new position, but not a new focus. You have things that you have been doing for years. And so as we continue to circle around CIT, tell me once again, so everyone can hear you, what will you do in endorsing CIT, and how will you use it to address the needs in your new position coming soon?
Well, let me first say I've 17 years in law enforcement, several of those on patrol. I never had CIT training, and I found out very quickly as I began taking the class just over a month ago how important the training is for law enforcement. I really found myself looking back over my career thinking I really could have used this earlier as a young patrol officer. And certainly with this position, we want to make sure that we're able to get every officer, whether it's detention or sworn member, through this training, because it's very valuable to have. It can save their lives, but also the lives of members of our community. And one thing that was very eye-opening was that years ago, there was only a couple of places to take people in Wake County. And as I went through this CIT class, it has exponentially multiplied. And what a blessing that is to have those many facilities and the areas available for mental health in Wake County. And certainly part of this position is making sure that not only if my eyes were just open to it after years in law enforcement, opening up to other community members and also other officers within our agency and their families who may be needing this. And so we're excited about getting the awareness out there. And, like you said, there's so many people out there that are struggling with mental illness that may not have come out, and we want to make it much easier for them to be successful with that, to come out and get the mental health that they need, the attention and the help, and just really partner with you all and Alliance and other corporations and just help people live a better life and take care of themselves and their family.
Thank you, Sergeant Sutton. As we conclude this panel discussion, I think tonight was very important. This town hall gave all of our constituents and our community members and our community partners an opportunity to actually meet you and get to know you differently. So I want to just allow you a few moments to share with the community what is one thing that they don't know about the Wake County Sheriff's Office or Raleigh Police Department, and just give us your last parting words. Deputy Chief Buffalo, I'll let you go first.
Sure. Thank you, ma'am. First of all, we at our core are a community-oriented policing agency. Chief Boyce, last year, he was so intentional about it that he created a separate division called Community Impact and Engagement, specifically knowing that we need to understand the needs of the community, and that not only understanding that is that we are not separate from the community. We are part of the community. We live, we work, and we play in this community. The police department and the community must work together to support one another, and not only that we hold each other accountable. That I always say there's unity in community, and safety is not strengthening the police. It's not something that the police deliver. It's to the community. It's something that we build together, and we flourish together. If we continue strengthening that trust and embracing our transparency with one another and being innovative and having town halls and discussions like this and maintaining an open dialogue to share our wins and our losses, Raleigh will remain one of the greatest cities in this country to live, work, and play. And Raleigh Police Department under Chief Boyce's leadership is committed to doing that.
Thank you. Sheriff Rowe?
Well, I want people to know that we value input and that we're here to, I guess you could say we're in the customer service business. And what we provide is safety and striving not to add to your hardships. I tell my staff all the time that we're only as effective as our training, our communication, our relationships. And to ask for help is not a sign of weakness, but rather a sign of strength. You want more tools in the tool belt to be successful in achieving your goals. So when it comes to the public, we remind ourselves that when we engage with the public, we're the only ones that's trained and paid to be professional. And we're the ones that's paid and prepared to be ready for the what if. So therefore, we have to think outside the box. We have to remember that people don't call 911 to say, I'm having a great day, and I just want you to know about it. No one shows up at our jail to say, I had a chance to go to Vegas today, but I hear this is a great place to hang out. We meet people at the most challenging times of their life. And so our goal is to make sure that we give good customer service and not add to their heartaches, but provide some resources. So we'll focus on working with all stakeholders to keep Wake County safe, to create opportunities for people to be successful. Again, we believe that public safety is the foundation for a successful life. You can have a clean environment, you can have a thriving economy, you can have sound education and great mass transit. Other elected officials are working hard to provide, but it's our job to keep you safe so you can experience all those amenities and then live life to the fullest. So thank you so much for allowing me to be here tonight. I look forward to working with you. Again, our goal is to be a good neighbor, a good partner, to let you know that we care and you matter. And we're here to work with you and not against you. Thank you. God bless.
Thank you, Sheriff Rowe. And then last but not least, Sergeant Sutton.
Well, Sheriff stole part of what I was going to say, but that's okay. We want to work with members of the community to make this a safer place to live, work, and play, not against them. And I want the citizens of this county to know that they're not an interruption of our work, but they're the very purpose of it. We're here to protect, but also to serve them. And our staff at the Sheriff's Office truly cares about their jobs and what they do. This is certainly a service-oriented profession, and everybody signs up for this for that purpose. So thank you again for this opportunity.
Lillian, sorry, start again, your audio.
Yeah, okay.
Okay. So 2 things you said tonight really stuck with me: unity and community, and the very purpose for our work. So Deputy Chief Buffalo and Sheriff Willie Rowe and Sergeant Philip Sutton, we thank you tonight for your transparency and to share. For one time, I think this is different for you to be able to just plainly express your successes, accomplishments, and your goals moving forward. Again, we thank you for your civic engagement and your increase attention on the public safety community. Thank you again.
Thank you.
We will now transition into our last portion of our town hall tonight. We always try to give you a tool to put in your tool belt. And if you are a partner with NAMI North Carolina, you know we ensure why partnerships matter. So tonight, when we did our town hall, we wanted to make sure you are able to hear from the actual person that is involved a lot in our partnership and helps myself and our other executive director and our board of directors work to ensure that this partnership matters. He is the spearhead that's been on the phone with me for several days and for several weeks to ensure that we get it right. So I wanted you just to hear where this partnership may have been strange to others, but to he and I, this partnership worked. So I want to introduce this actual servant that's been helping me for the past 3 weeks, Mr. Gary L. Wood. Mr. Gary L. Wood Jr. serves as the Grants Accounting Supervisor with the Wake County Sheriff's Office, where he oversees grant compliance, financial stewardship, and strategic fund administration. He brings nearly a decade of specialized experience in grants management and regulatory compliance, specialized experience in grants management, and along with a broader public administration background spanning local government, nonprofit organizations, and higher education. His work focuses on strengthening accountability systems, enhancing operational efficiency, and supporting data-informed decision-making within public sector environments. Mr. Woods holds a bachelor's degree from North Carolina Central University and a Master of Public Administration from North Carolina State University. He is currently completing his doctorate in organizational leadership at Gardner-Webb University, where his scholarship centers on leadership effectiveness and organizational performance in government settings. He is committed to advancing ethical financial management practices and contributing to the development of resilient, service-oriented public institution. Mr. Gary L. Wood, we welcome you tonight.
Good evening, everyone.
Now, Mr. Wood, you know, some people are looking and probably strange that we're doing a partnership together, but I think a lot of individuals are unaware. We've partnered together for years and for decades. So tell us tonight, with our new partnership with this grant, tell us the name of the grant and why this grant is so important to the Wake County Sheriff's Office.
Thank you for that. I think everyone here tonight has spoken volume about the impact of this grant when it comes to not only building our relationships within the community, but also just showing that we are one and that our services and that our expertise and that our resources can come together as a coalition to build our community. And so for the Wake County Sheriff's Office, this means a lot. So our deputies are usually the first out there on the calls. And so providing them with the resources, providing them with the education about how to act in certain situations, provided them with the resources to make sound decisions, allowing us to be well educated in these ever-changing fields, allows us to be advanced, allows us to understand what's going on. And sorry, I have my little one right here telling me on my shoulder she wants to be seen. So so allowing us to build our coalition of community partners allows us to be well versed and well educated. And so our partnership with NAMI is bridging the gap with mental health, and it allows us to not only advance our outreach in our community, but allows us to be well educated, allows us to train our deputies, allows us to be within the community, to continue to build on top of our resources, to bring data analytics into the Wake County Sheriff's Office. So when we make these kind of decisions, that they're data driven as well, and that we're really using these resources and our knowledge to make sound decisions, to make a whole community effort into mental health.
Thank you, Mr. Wood. And then for your last question, what is one thing that you're looking to see as an outcome after this grant has been concluded?
One thing I'm looking to see is our ability to, when we're going out to these responses, that we're bringing in mental health advocates, that we're allowing us to create those partnerships, that when we're going out to certain calls, that we have that expertise there, that those experts with us to allow us to make sound decisions, so people are getting the right services, that we're building a community where we're building trust, we're building the knowledge, we're building a coalition in which public safety meets public service, and that public service brings a community. So,
well, Mr. Wood, it's been a joy for NAMI North Carolina to work with you in the Wake County Sheriff's Office, but most importantly, we're excited about what's to come. I thank you for your support and your dedication to ensure this partnership is efficient, and it is the most amazing thing that will be in 2026. So again, I thank you for sharing this as an example tonight. As a nonprofit, we always want to ensure that our community partners are able to see different examples of partnerships and for them to seek other opportunities within their own organizations. So thank you again for your support, and I look forward to working with you in the next 2 years.
Thank you. You guys make it easy for us.
Thank you, Mr. Wood. And now, as we move on to the end of our town hall, my colleague Amy Brundle will come forward, and we will see, Amy, do we have any questions in the chat that we need to address?
We do. We have a few, and we're actually going to start with one of mine. So we've got several people in the audience today that are from different jurisdictions across the state. And so I'm curious for our panelists, what could some of these other departments across the state learn from your stated efforts and strategies today that they could then go and incorporate in their communities as well? What are some of the major takeaways for other law enforcement agencies across North Carolina?
Deputy Chief Buffalo. Okay. All right. Sheriff Rowe, do you have any you can share with us?
I think the key is communications. I said earlier, we only as effective as our training, our communication, our relationships. So as agency heads, we have to reach out for each other. We have to learn from one another and share our resources. As the old saying, there's strength in numbers. So as we combine our resources and reach out, funding is one of the keys. Staffing is very important. That's one thing we learned from the pandemic. Without the staff, you can't get the work done. And so we're still facing some of those challenges. However, the more we communicate, the more we share information, ideas, support one another, I think we can learn from each other and spread the resources to reach the masses.
Thank you, Sheriff Rowe. Amy, will you read the question one more time? Deputy Chief Buffalo, we have one question that we wanted you to answer, give an example for the Raleigh Police Department. Amy?
Yeah, and I'll tweak it a bit based on something that just came up in the chat. We've got some folks on the call tonight from a wide variety of different communities around the state. And so what are some of the things that the Raleigh Police Department is working on that could be incorporated in some of these other jurisdictions, especially in rural communities?
Oh, great question. I'm sorry for the delay. That was my side froze, so I apologize. I wasn't engaged. Some of the things that I see that we can do is regionalize some. Fortunately, we have some services here in Raleigh, but one thing that I see that regions can do is try to regionalize their resources to where it could be a force multiplier. And so we try to find out what those needs are because in law enforcement, we have jurisdictional lines. People with mental health crises do not have jurisdictional lines. And so we need to collaborate more and partnership more in a multidisciplinary approach to help folks who are in transit. We do have a transit population that comes through Raleigh and Wake County. And so we do have to collaborate a lot more in regionalizing some resources.
Yeah, excellent. Thank you. And now I'll take a couple of questions from the audience at large. We had one question that referred to Sergeant Sutton saying that you could have used your CIT training much earlier in your career. And so this person is wondering if anyone on the panel would welcome CIT training to be legislatively mandated for police, especially with some of the new laws that have passed given current events. Do you think that would you ever support this kind of measure?
I certainly don't think that's a bad idea for law enforcement officers to have those training. I look back to the 2008 when I went to the academy, and the mental health block then was certainly maybe a day or two at most, and then you get out and you see just the bulk of the calls that law enforcement's responding to these days. And so certainly not a bad idea for every law enforcement officer and detention officer out there to have that training with them moving forward.
I might add that when you mandate something such as from legislation, funding has to come with it. So if you pass a law, you don't fund it, it makes it difficult for people to meet those goals. I think we, as agency heads, understand the need, and we find ways to utilize our budget to make sure we do get this training to people. We look at our telecommunicators as well as our detention officers and our deputies to get this type of training because of the information that they deal with on a daily basis. I'm even reaching out, trying to coordinate for my administrative staff because when people come in the office, whether it's dealing with civil papers, they're going through crisis, and to be able to recognize it and get them immediate resources is important, as well if you're experiencing one yourself. So it's very important, and we have to be innovative, think outside the box, how we can utilize our funds. And go along with your first question about other agencies, one of the things we do with our peer support unit, we send them to other agencies to help them when they're going through crisis. We send our dogs and every resource we have to support people. So having that regional approach, as the Deputy Chief spoke about, task forces, so that we're able to touch more people. That's the key.
Mm-hmm. Yes, thank you for adding that focus. We have a couple of questions here. One of them reads that, what can we do to maximize the quality and integrity of our mental health programming that we're offering across the state? Which I know can be kind of broad. So whatever angle you'd like to take in answering that question, feel free.
Well, I think it starts at the top. You have to model the behavior you want to see in others. So as leaders, we have to let people know that we care, and we have to demonstrate that day in and day out. And it starts at home, with your family. As we're out trying to save so many other families, we can lose our own. So we have to do it at home. We have to do it in the office, and then other people can see that our actions match our words, and that's how they are able to believe that we're there for we have their best interest at heart. So I think that's where it starts at with your budget. When I came in office, I realigned things to address things like officer wellness and morale, family support, because those are values and that need to be addressed to let people know that they matter and they're valued, and they need that kind of structure and that support in order to perform their duties day in and day out.
Yes, I echo what Sheriff Rowe has said. We also have to allow the General Assembly that they have to invest in this program. And they have to invest in this crisis. I mean, it's not going to get any better just sitting on it and thinking that more folks are going to come if we don't pay the folks to treat the folks, to open up those 30 beds that the DHHS needs. So we have to invest in this program holistically.
And then, Amy, I'm going to add from a NAMI North Carolina perspective, we must go where they are. We must be on the same playing field. So in order to meet the needs of those that the needs need to be met, we must listen. We must make sure that we are addressing not our want, but their actual needs. And the only way that you can get what a person needs or what the community may need is by getting their feedback. So I know at NAMI North Carolina, and both at the Wake County Sheriff's Office and the Raleigh Police Department, it's essential that we take that feedback and do something about it. So my most important thing is that we're not doing what we want to do, but what the need is.
Yeah. I'll take two more questions. One person asked if there is a way to integrate social workers within the CIT program to be another trained person to answer calls with the first responders.
That's a great question. I think that's discussion that we're having now as we try to partner with Health and Human Services. When these calls come in and you evaluate them, if they're not mentioning any crime that's been committed or no one's in danger, you want to make sure a trained, certified person reaches them first to try to de-escalate and get the resources needed. And so the big question is, where should these people be housed, with Health and Human Services or with law enforcement? I think the thing, as we try to rethink and reimagine how we deploy our resources to address the challenges, the needs, the expectations of our staff and the public, one thing that has not changed, when people call 911, police, fire, and rescue respond. We don't have the luxury of saying, call me back tomorrow at 9 o'clock when I get to the office. So when we talk about taking the sources to the people, whether it's 3 o'clock in the morning or at midnight, someone has to be available. Other than law enforcement, it's going to respond when we have a crisis situation. And so these are things that I'm focusing on. And I know it takes funding. And one of the things I've done to try to help with the funding aspect, we created a Wake Sheriff's Charitable Foundation. And with this foundation, it's a 501c3 or nonprofit. We have a board of directors that consists of people in the community and retired sheriff office personnel. We raise money to support sheriff office operations, as well as to support staff and their family members who are facing crisis and hardships, and to support nonprofits who are addressing public needs to make people life better. So that's another way to get funding. There's many businesses that will contribute. And so we think outside the box, how this foundation can allow us to reach people in the community, as well as taking care of our own in the process.
Yes, I spoke about Acorns. This team provides field services. We actually utilize the officer social worker co-responder program now, but we use a motto or a method: care and safety first, enforcement last. That's the approach we use with Acorns. This is a social worker and a law enforcement officer responding jointly to engage our residents in their need of crisis and to give them some services. And they provide outreach, education, case management, investigation, and intervention services. So we practice that now.
Thank you both. Final question here is we had a viewer say that they respect and appreciate the emphasis of crisis services. However, sometimes feels like when certain current events happen, the sensationalization of some of those events can pull funding toward crisis services and away from more long-term health strategies. So how can we balance the need for preventative and long-term rehabilitative services with our need to fully fund crisis services?
So one thing I say is everybody has to be at the table and sharing the needs, expressing what's needed so that when we divide that pie, everything gets addressed. You know, I try to tell my staff every day that we deploy ourselves in a servant leadership type of role. Understand that it's not about us. It doesn't matter who gets the credit, to put the well-being of others before yourself and to be reliable. Don't promise anything you can't deliver. Then also to use the letters ACTS as a motivation and inspiration. You know, A is being aggressive, giving it your all. Be first at the table, because if you're not at the table, you're on the menu. C, be committed to being the best that you can be, developing your skill set and providing the best service. T, be thankful that God chose you at this time to serve and make a difference in life. And S, for being sincere. Be truly committed to what you're doing, because people can see through you if you're a fake or a phony. Again, we just got to make sure that we're including everybody at the beginning and not at the end, so we can get the successful outcome that we're seeking. And the private sector, you know, with us, we believe that the public, private, nonprofit, faith-based partnership is the key.
Again, echo what Sheriff Rowe has said. I can just talk about Acorns all night, but Chief Boyce has been intentional about it, and City Council has funded it. And so we've been very blessed to have those continual funds to provide this service in this co-responder model. And not only that, we have funded Acorns. City Council has funded Acorns, but they have also funded peer support for officers, because officers are experiencing these crises when they respond to these high-profile incidents, and these particular calls for service or stay with us. I can recall several calls for services in my mind that come back up and things that trigger those. But we have a peer support mechanism for our officers as well as those in crisis. And that funding has been whole based on the budget from City Council, and we're very grateful.
Excellent. Thank you, everybody, for your thoughtful questions. We appreciate you being engaged.
Thank you, Amy. We're going to go to our last parting slides. And at this time, everyone that's joining us tonight, we hope to see you. Our Advocacy Day 2026 at the General Assembly will be April 28th, 2026. We look forward to seeing you and for you to continue to support and help NAMI North Carolina advocate for mental health at the General Assembly. And then I am happy to announce that we will have a Justice in North Carolina Town Hall Part 2. We have reached out to our Attorney General, and he has deeply apologized for not being available tonight. And so our second town hall will be based on his role and different accomplishments under his Department of Justice role. So please join us. More details coming soon. And to my colleague, Virginia Rodelia, she is the director of our NAMI North Carolina Helpline. So we want to share that information with you tonight at 1-800-451-9682 for text features that we now have available, 919-999-6527. And for email, helpline@naminc.org. We want to also, at this time, recognize any special guests that are joining us tonight Are there any elected or legislative officials that are joining us tonight? I had a few that said that they would be joining us and would reach out to show NAMI their support tonight. If they are here, please let us know in the chat or just wave your hand. Okay, I don't see any coming off mute. And we always have to have a plan B, and she knows we are. Oh, there she is. I'm looking for Senator Candy Smith, who is a great partner in Pitt County with NAMI North Carolina. She has helped us write many legislation pieces that push mental health forward. And so, Senator Smith, I was looking for you. Would you want to say a few words? Senator Smith?
Hello. It was wonderful to be able to hear everyone tonight. I was excited and definitely listening when they said legislation. If we're going to put anything about CIT in legislation, make sure you run the money.
Thank you, Senator Smith, for your support. Always, you've been a big advocate, and you're definitely my Shirley Chisholm. You bring a chair to the table. So thank you for everything you've done for NAMI North Carolina.
Thank you all for this panel. And I'm familiar with CIT when I was on the city council, and was able to participate in a part of the training because I wanted to see what it was about. And I think it's much needed. So thank you so much for what you guys are doing. We appreciate you.
All right, I'll see you soon at the General Assembly.
All right.
Thank you. And last but not certainly not least, she knows I always have a plan B, but we have a great support system now at NAMI North Carolina. She's come in with her boots on the ground, and she knows what advocacy is definitely about. We've worked in the trenches for over 20 years together, so it's my joy to actually introduce the interim executive director, Lisa Lowe Hall. Do you want to come and say a few words tonight?
Yes. Can you hear me, Lillian?
I can.
Yay, I finally was able to make it. So yes, thank you so much. I'm Lisa Lowe Hall, and I have the absolute pleasure of serving as the interim executive director for NAMI North Carolina and partnering with their dedicated board of directors. I would be remiss if I did not just say I am inspired by this town hall tonight, the level of collaboration and passion that has showed up on this call is just incredible. It's informative and it's much needed. Hats off to my team, Lillian and Amy, for your leadership through this town hall. Thank you to our community supporters. And I just look forward to doing my part to help move all this great and much needed work forward. Thank you so much, Lillian.
Thank you, Lisa. And to my dedicated, patient colleagues at NAMI North Carolina, I thank you for every day working with me to make sure that we are in the community. To the NAMI Board of Directors, Gail Pruitt, we thank you for your support and dedication always. Amy, I now pass to you for you to conclude our town hall for tonight.
Yeah, thank you to everybody who signed on. We've taken a lot of your Thursday evenings, so I'm going to make it quick, I promise. But in closing, we just wanted to once again offer a huge thank you to all of our speakers and panelists for giving of your time this evening to offer these updates and your priorities for justice and mental health moving forward. Of course, NAMI North Carolina is dedicated to investing in these partnerships so we can continue to work together to bring better mental health to our communities. So we appreciate all of you and the incredible work you're doing in your areas of focus to contribute to this mission. Of course, I'm shouting out my colleague Lillian Davis for her innovation and imagination in getting events like this running so that we can keep bringing successes, new ideas, and transparency to all of the people that we serve across North Carolina. And we also, of course, want to thank all of you for giving of your time to stay engaged, learn about what's happening in your community, and express your voices. Only through good advocacy and working together towards a common goal does change truly happen. So we'll be posting this session on our YouTube channel in the next couple of days in case you'd like to review any part of it that you might have missed or share this session with others. And of course, if you'd like to learn more about NAMI North Carolina in general, I would be a terrible marketer if I did not plug our website. It is www.naminc.org. Please visit to find out more about future events. Until our next event, we wish everyone a wonderful evening, and thank you again for joining us.